This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning. In case you're wondering, it is 8:05. All right?
John.
If your clock says 9:05, you forgot to turn it back, all right?
You missed us.
That's right. You missed it. You missed us, all right? Whatever. But good morning and welcome to the show. Health Watch, of course, every Sunday, 8 till 9, Talk Radio 1210, WPHT. And as you heard the man say, Dr. Molly Fantasia is here, the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. We'll talk on this show about the who, what, when, where, why, and how of Innovative Medical and how it can potentially help you and anyone you know as far as improving your overall quality of life. We will discuss that, plus some cases. And, of course, we welcome your participation at any time at 855-839-1210, 855-839-1210. That is our number here in the studio. As I said, anytime during the course of the show, just pick up the phone and call if you have a medical challenge or you have a question about anything we're talking about here on the show, 855-839-1210. You know, Dr. Molly, with all of this stuff, and we normally start a little differently, but all of this stuff about corona.
Here we go again.
Right. One of your patients met me last week for the first time, and he's called this show.
Okay.
And it's John from Marlton.
Oh, yeah.
Right, yeah. And John said to me, he says, you know, I listen to you guys. He said, I do what you talk about. Right. I do the vitamin C, vitamin D, and zinc, all under the direction of Dr. Molly. He said, I feel great.
Yep.
So my question is, with all of this stuff, I don't hear enough people talking about the immune system and boosting it and so on and so forth.
The thing is, you and I both know, listen, the regulatory bodies make it very difficult for people like me that have facilities like I have to talk about prevention.
Yes.
They say you cannot say you prevent corona, and we don't want to say that.
That's right.
But you are 180% right saying that without a good immune system, you're not going to prevent anything.
That's right.
Including corona.
Right. And, you know, we were talking, and I just feel like that whatever you're doing with me, I feel like it helps me in terms of corona or any other medical challenge.
Because it's helping you what? Maintain the quality of life, helping you continue to have good health.
Right.
And look, none of us get out of this world unscathed, right? None of us, right? We all go out the same way.
Right.
Okay. So, but the point is, we want to have the best quality of life, the best immune system possible, given our comorbidities, etc., to maintain a quality of life and a healthy life for us.
Right. Which begs the question for me, how come people are, I mean, we're talking about it.
Of course.
Because that's what you do.
Right.
But do you hear the national news talking about it?
No.
Do you hear anybody?
No.
All they're
Listen,
saying
they
is,
gave the president a hard time about taking what? Taking nutraceuticals. Guess what? Was he wrong? No. Yes, he took the conventional medications. You know, there was an obligation to make sure he did. And we feel that way about our patients. We have an obligation to make sure they get the best medical care possible. But guess what? We also want them to get the best natural substances out there to augment that medical care. And I think the president was very judicious in how he did this.
Right. So it was just like I'm thinking about it the whole week, and I'm saying, you know, this is something that we should talk about.
God bless John.
Right, that's right.
And John, John,
right.
too.
It just boggles my mind that all the stuff you hear, and you know, we're going to shut down again, and all this stuff,
and it looks like that's going to happen.
That didn't do any good before. So I
hear you.
It's like,
well, here's the deal, John. You know, why does our immune system go haywire or get dysregulated? I mean, there are so many forces, not just because of corona. That's the other thing. Do you really think it's just because of this virus that our immune system went downhill?
No.
Usually people who get this, they talk about it. Sort of under the radar. They talk about it. They say people who had comorbidities, they're the ones. Guess what? What are comorbidities? They have a bad immune system.
That's right.
So let's put on our thinking caps. And why do we get this dysregulation? Stress. Right now, I'm hearing from my patients, they are so stressed about what's going on in the world. Right? What's going on with Corona? What's going on with the election? Stress. Stress revs up our immune system, right? So then it can go into overdrive. And what do you think happens, John? You then go into dysregulation. That's one of the things. Sleep and stress are part of the problem.
Right.
So,
we have, I think, Belmar, New Jersey. Is that right, Jim? Anthony in Belmar, New Jersey. Anthony, good morning. You're on Health Watch with Dr. Molly.
Hi, Anthony.
Hey, good morning, guys. Good morning, Dr. Molly.
How are you, buddy?
My question, I'm actually doing okay so far.
Thank God.
My question has to do with taking a statin, and I'll give you my scenario and make it kind of quick.
Cool.
What happened was that I went to a Lifeline screening, that volunteer.
Sure, I know it well. Yeah.
So basically what happened was I went there and it came back and they said that my protein enzyme was a little high, maybe follow your cardiologist. I did that, and I had one of those CT calcium scans.
Good.
And it came. Oh yeah, they're great. I don't know why more people don't actually look into them.
We use them.
It was $120.
Go ahead.
Yeah, it was like $120. The insurance don't cover it.
Right.
So my score came back 437.
Okay.
And when I spoke to my cardiologist, he said, you have a couple deposits, but it's really not life-threatening or anything like that. You're pretty active and, all that jazz. So I got another opinion from another cardiologist because he wanted to put me on the statin, and I read a lot of bad things about him. So my question is, my cholesterol levels and my blood work is actually good.
Okay.
But he's insisting that I take the statin. It's the generic thing of Lipitor, atorvastatin.
Yeah, sure.
So
okay.
My question is, there seems to be a gray area,
right,
where some people say you don't need the statins, do it naturally, and I've actually changed my diet a whole lot, which I was pretty good at.
Great.
But I'm not heavier or anything. I lost like 7 pounds already.
Good.
And my blood pressure, I was taking Diovan, and I actually stopped taking my Diovan because my pressure went back to normal.
All right, so help me, Anthony. Now, you didn't just stop your Diovan, right? You worked with your doctor to do that, right?
Oh, no, yeah. Well, I asked the cardiologist, and
Okay.
I told him that I had been taking my pressure. I have a monitor at home, and I said, "Listen, Doc," I said, "my numbers have been really good across the board." He says, "Well, then take yourself off and see what happens if it gets high. Take it." So, how do you determine whether to take a statin or not?
Well,
and are they safe?
that's a wonderful question, and I can tell you that Dr. Testa and I wrestle with this every darn week, okay? Because we look at our patients and we say, all right, where's the danger here? Look, you obviously had some plaquing. How old are you, Anthony? May I ask that as well? Because that feeds into this. Go ahead.
Yeah, 58.
58. So you're in that range, so you still got some, you're working, you have some stressors, that kind of thing. Look, plaquing is inevitable most times. Most people have some plaquing, right? Because you can't live in this world and not have some plaquing. All right. Question is, where is the plaquing, right? How much of the plaquing? And then it comes down to nothing more than medical opinion, which is why they call this the art of medicine and not purely the science of medicine, okay? And I will tell you, Anthony, you're a great candidate for some IV EDTA. In other words, if you come in and take 5 treatments or so, I bet you we could even improve your blood flow more, and I bet you when you went back for another CT, the plaquing CT, you'd probably have a real reduction in that. And remember the other thing, and I think I mentioned this last week, when you go in for that CT scan, okay, for the calcium score, it's also giving us plaquing outside the vessel, right? It's not just giving us plaquing inside the vessel. So there are so many things to take into consideration. You went all natural. Did you go and get some red yeast rice or whatever? Did you do that? Are you taking the fish oil? Those kinds of things. Are you doing things with natural products too? Good.
Yeah.
Well,
I am. I've actually been on the fish oil for a number of years, and I actually just ordered something off of Amazon. It's supposed to help with pressure and the plaquing, but my question is, when I went to the second cardiologist for an opinion, he showed me a graph, and I asked him. I said, I had two on the stress test, the nuclear stress test.
Sure.
And I said, why didn't the stress test? Because this was in the past 5 years. I said, why didn't the stress test pick this up? And he showed me a graph.
What was
this is
his
what he
answer?
did. Yeah. Well, this is going to be good. He showed me a graph, and he says, look, this is the normal artery. This is the second, third. He said, you're in between normal and just starting to get it. And a stress test would not pick that up. And I said, well, I actually had a heart monitor, too, because I have some anxiety.
Listen, I think you have great insurance. Listen to me, Anthony. I think you must have great insurance. You should come over and see Dr. Testa. That's good stuff you got. You've got great insurance, and that's why you're loaded up with all these tests. Look, there's such a thing as over-testing as well, right? Because then it adds confusion to the patient. Here's the deal. It sounds like to me you'd be a great candidate for a short course of chelation therapy, and I would say to you, you no longer will be that in between good and bad. You'd probably be absolutely excellent. Okay,
Anthony, thank you.
Really, this is a great call.
Thank you for the call, and we'll give out Dr. Molly's.
Keep up the good work.
We'll give up Dr. Molly's number. We'll give it out after the break.
Thank you.
You'll be able to call her and talk a little further.
Thank you. That's a great call because you know what, John? Here it is again, right? You've got to realize you've got to go by medical opinion. And you also want to take the history. Did his father have a heart attack? He's 58. Is he under a high-stress job? Is he a police officer? Maybe, you know. You know what I mean? I mean, come on. There's so many things to look at. But I would tell you the fact that his plaquing is minimal, that is an excellent thing. I would, if it were me. Now, I'm talking just for me. I'm not talking for Dr. Testa. I'm talking for Dr. Molly. If that were my test, I would probably just continue to do chelation, take some other supplements that we would recommend, and stay the course with the diet, etc.
And talk about the statin drugs. How many times have you said, okay, we're going to try this, and the cardiologist recommended it, and we tried it, and it was a terrible reaction.
Correct.
Including the last one, which
that was the brand new ones, the injectables.
Right.
Listen, there are so many new drugs out right now that it just blows my mind. And I'll tell you, just staying on top of it. So Test and I really do look at these things and say, okay, really how much risk is our patient? By the way, I had a very good patient, and you'll know who I'm talking about. He used to say, hey, Dr. Molly, liars figure and figures lie. And you know who that was.
Exactly.
And he was a great Philadelphia.
Yes, he was. Okay. Coming up on a break, it's Health Watch every Sunday, 8 till 9. Talk Radio 1210, WPHT. Questions for Dr. Molly, 855-839-1210. That is our number here in the studio, 855-839-1210. With Dr. Molly Fantasia, I'm your host, John DeMasi. We're returning with more of today's Health Watch after these words. We are back here on Health Watch, and as always, operators are standing by at Innovative Medical Associates. And if you'd like to talk to them, and you heard a caller earlier, and it perhaps requires a little further discussion, well, if you want to do that, you want to sit down with Dr. Molly, the initial consultation is complimentary. And the number for the operators, if you're to call right now, is 856-489-0505. 856-489-0505, Innovative Medical Associates, Marlton, New Jersey. And, of course, the website, innovativemedicalassociates.com, innovativemedicalassociates.com. A lot of good information on the website as well. And also, do want to remind you that if you miss any of today's program, and people were telling us this week in the clinic, Dr. Molly, they listen to both shows.
Well, I'm thrilled.
That's good. I mean, they listen to the morning, the live show, and then the replay at 4 o'clock. So it's the Health Watch replay from 4 until 5 every Sunday right here on Talk Radio 1210 WPHT. If you have a question for Dr. Molly right now here on Health Watch, the number in the studio, 855-839-1210, 855-839-1210. Dr. Molly, we normally start the show by kind of giving folks an overview of what you do, and we didn't do that this morning, so we'll kind of catch up to what we normally do here on the show. Innovative Medical Associates, what's it all about?
Well, it's pretty simple, John. We're a group, a collective of healthcare providers who work out of my facility, and we actually use hydration as a vehicle by which we deliver natural substances in order to help patients reduce their need for medication. And that's really my specialty. That's what we do. And I can tell you that in many cases, we're able to reduce the need for medication or reduce the dosing of medication, thereby really holding down the side effects and continuing a patient in a safe manner to help them. So again, it really depends on why a patient comes to see me, but our overall philosophy is of one that we want to improve a patient's quality of life and use these therapies as supportive care.
You mentioned earlier, we had the caller, and you said come in for 5 treatments, and I probably can help you with that.
EDTA, yeah.
EDTA. Everybody's different, right? Depending on the circumstances.
Look, I see a whole lot of people who have autoimmune problems. Talk about your immune system dysregulated. I see a lot of people with immune problems. I see a lot of people with cancer challenges. Those types of things, they are going to need a longer protocol, and in order to support them through their challenge and maintain what's left of their immune system. So, of course, it really depends on what kind of problem the patient has.
And give us like a ballpark. What can you expect to start with? You mentioned 5 to this one particular
5 weeks,
person.
Because he was telling me I want to see his calcium score, though.
Right.
I want to see his calcium score. But you can start to really effectuate the change in as little as 5 to really 15 treatments. It depends on when the patient comes to me.
Later on, I know you want to talk about something, and we're going to get into something in side effects.
Sure.
And I always ask you that because we all know about prescription meds.
Oh, sure.
And the many side effects.
Right.
What about with the hydration and with
natural substances?
Yes.
Well, you know how I feel about that. We go into the health food store, and sometimes we get a very knowledgeable health food clerk. Sometimes we don't. And the question is, how do you know what really products to really take for you? And that's where you get into a little bit of a challenge, because you really need someone who understands what constituent in that product is really doing the action that you need. So there's a lot to be said for having a place like ours to help you really look at these things and say, okay, this will work for you, but this might counteract for your medications that you're on. So, yeah, you need advice, John.
And your nurse Barbara is really.
Forget about it.
I heard her talking to a patient the other day, and she was going through this whole thing of, well, this, you take that, and you take this, and
right.
So, without that, I think you walk into a health food store,
you're at the luck of the draw.
Exactly.
And that's another whole problem. And some point we'll get into maybe herbal teas and some of the reasons why I think they're medicinal.
Yeah. Now, a lot of people call you and they'll say, hey, Dr. Molly, what do you think about this? What do you think about that?
I love doing that, but really that's not serving the patient well or the caller well.
Right.
It really isn't. You really need to come in, sit down, chat with me. The consultation for 15 minutes, and I use that term lightly because generally I never get out of there in 15 minutes.
The next 15-minute consultation will be the first one.
That's right. So, but really, even something as simple as that, the free consultation can help you get on your way. But primarily, what I'd like you to do, if your condition warrants it and it's safe to deliver the hydration, that's where I want you to go, because A, it's effective treatment. We can do it fairly quickly, and we can deliver in a doses of the natural substances that are appropriate for you without putting you in harm's way.
I mentioned we started the show, and we were talking about corona and immune system, and I feel that. Like, I feel sometimes, and I know this is kind of subjective, but I feel like I can feel it working. You know what I'm saying?
I believe
that like you get a little tinge of a cold, and then all of a sudden it's gone. And I'm saying that has to be all of the reserve, the vitamin C, and all the stuff.
Yeah, sure,
right.
And some of the other antioxidants. Look, there's a lot of medical and scientific data. That's the thing. There's a lot of scientific data about many of the constituents that I use, if not all of them, really. And you'll see this in using PubMed. You can go on the internet and look at these things. PubMed is one of them. The American Journal of Medicine is another one. I'll tell you, the European journals, the European medical journals have a flow of this information, so much it could probably fill up 2 buildings, okay? And that's really what you want to do. You really want to look at that.
So I guess it's researching. And
sure, you can research, and what I'm saying is I've done a lot of research myself.
Oh, I know you have. Yeah.
And so what will happen is if you come in and you fit a certain... Look, there's one thing I want to say. You know, when you go into your regular doctor, if you fit a certain profile, here's your standard of care. Boom. Here's what you get. Get out. See you around. Don't forget to give your copay. Okay, so I'm laughing about this because actually
that's
Mark,
the way it is.
Mark and I laugh about that. Don't forget to give your copay and get out, right? Okay. Bottom line is this. Yes, that's good medicine. Of course it is. No physician wants to hurt a patient. But you know what? There's a lot more that can be done in places like ours if done appropriately. And I believe we're one of the best.
What can somebody expect? The initial consultation, you kind of explain everything.
You talk.
If they start treatment, the hydration, what can they expect?
Well, in the beginning, we're going to put together a protocol based on whether they bring in their blood work or I do some blood work, that kind of thing. We have to talk, initially, put together a protocol that is for them, not for everybody else in the room that day. Now, there's some overlap in the protocols because I use some constituents in many different scenarios, but let's face facts. You're a different individual than the guy sitting next to you in the chair, and
yes.
your protocol will reflect that. And somewhere between 5 and 10 weeks, we're going to talk again and see where we are and change up this protocol and see what other kinds of testing we need to do and those kinds of things. And we will send you out for that. I'm a big believer in that calcium scoring that the gentleman spoke about. You know that.
Yeah.
I love it. And I also know about the life screening. When they're around, I hope my patients do go to that, and I encourage them to do so.
By the way, this week my bag was a different color.
Yes.
And I asked the question, and the lovely Linda said, "Well, here's what we did." And what you did.
Again,
so
listen, I have people who ask me all the time, what's in my bag? Okay, I'll give you an overview of what's in your bag. I am not going to go into the specifics of how I mix the bag, meaning my protocols. They're really proprietary. And you know what? Most physicians won't do that either.
Right.
They won't tell you what their trade secrets are. Okay, they just want mine.
Does Coke give out their recipe? No.
No.
Okay. Coming up on a break, the show is Health Watch every Sunday, 8 till 9. Our live version here on Talk Radio 1210, WPHT. 855-839-1210 is our number here. And as always, we tell you, now's the time to call because happened again last week. We had a couple of calls at the end of the show. We tried to get them, all of them, and we missed one. So we don't want to miss your call. 855-839-1210. 855-839-1210. It's Dr. Molly Fantasia, the Ph.D. doctor, executive director, and founder of Innovative Medical Associates. Dr. Molly is here, and I'm your host, John DeMasi. We're coming back. More of today's Health Watch after these words. Welcome back to Health Watch. Operators standing by right now at Innovative Medical Associates at 856-489-0505. 856-489-0505. That's the number for Innovative Medical Associates. Now, you can call right now. You want to wait till after the show at 9 o'clock, they'll be there. They'll be there all day, and you can call them during the week. 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, we have our Health Watch replay every Sunday from 4 until 5. So it's today's show, later on this afternoon, replayed from 4 until 5 every Sunday here on Talk Radio 1210 WPHT. Our number in the studio right now, if you want to talk to Dr. Molly, 855-839-1210, 855-839-1210. Dr. Molly, we just touched on herbal teas earlier, and I know you wanted to talk about this because this is about side effects.
Right.
So talk about this.
Medicinal herbal teas. But let me let's talk about how I got to looking at this a
Okay.
little more carefully. I had a young man come in with his wife. Actually, the wife was the consult. Okay,
Right.
The wife was the consult. He comes in with her, and she's taking an herbal tea. And I say young because they're in their 50s. She's taking herbal remedies for menopause, right? Well, he's drinking the teas too. Well, one of the things I started thinking about, and then he starts telling me a couple of problems that he's having, and I said, well, do you know that there are some herbal teas that actually work on estrogen receptors and might cause your estrogen levels to come out? Because he went to his doctor, and the doctor said, your testosterone level's low and your estrogens are up. And he's thin. This guy's thin. He's not, he doesn't fit the profile. And then I find out the wife is taking all these teas, all right? So he's taking them, and I start thinking about this, and I said, I happen to know these particular teas, and they have an estrogenic effect. And he went, oh, I didn't know that. I thought tea was A-okay. So it started me thinking about the medicinal uses of herbal teas, right? So, we have to treat herbal teas just the way I treat all nutraceuticals, because there are certain constituents in the herbal teas. And by the way, some of those constituents I have used in our hydration therapies. So we look at this and we say, well, what kind of interactions, and is there a way for you to look at it? Well, guess what? There is. There has been a lot of data, in particular from the West Coast. Apparently, this is quite natural for people to use herbal teas in the West Coast. I'm not quite sure why, but they seem to use it more than we do. So there are things like chamomile, cinnamon. Of course, we know cinnamon can help diabetes. Fennel tea. People use fennel tea. But what we want to make sure is that none of these have an interaction with A, your medications, B, on the neuroendocrine system, which would then cause a problem with your immune system. And what we want to do is look at those as related to particular patients. So we used chamomile? Yes. Would I use it with people who are on benzos or contraception? Or would I use it for women who possibly are having breast cancer like tamoxifen? The answer to that is no. There is some side effect. So how many women have come into me and said, listen, I'm taking that, they had a cancer bout and they're taking chamomile tea. And I find out they're on estrogen modulators. I said, get off of that chamomile tea. Interesting thing.
Why? Because synergy of that and
right,
okay.
Right. There's a synergistic effect, and we need to look at that. So in addition to that, what you want to do, if you are using some of these things are dosed just the way you would dose medication. So you just don't brew up a big jar of these teas, right, and start drinking them, right? We know ginger is excellent, right? For what? Ginger has an anti-inflammatory property, and I've used the extract of ginger many times. But we want to make sure that we use it correctly, and we want to make sure that we don't have a problem. It's potentially very safe, but there are some side effects to ginger. You can get some abdominal pain. You can have an allergic reaction. You want to look at arrhythmias and ginger tea. So these are the things. So would I use them very sparingly in my IV? The answer is yes. I want to make sure that somebody doesn't have a problem. And guess what they interact with? Aspirin. There's an interaction with aspirin. There's an interaction with NSAIDs. Warfarin. You have to be very careful if you're on blood thinners. So these are some of the things. And I tell you what, I look at this and I say, okay, so guess what? We don't want to do this. Now, we all know there's a drug out, or an over-the-counter drug it is, for IBS with constipation. It's been a big deal, right? They're pushing it like crazy. It's because it contains peppermint. And peppermint is completely safe. It does have some side effects: nausea, headache, flushing, and some allergic reactions. It has some interactions too. Guess what? On the P450 metabolic pathway. Now that's a little intricate, but I want to say something. Many times cancer drugs work on that pathway. So would I give our patient that particular over-the-counter drug? No. I might look at something else that would stop the nausea, like a homeopathic remedy that I know doesn't interact with certain pathways. So these are just a few things, John. Nothing big.
Well, you've often talked about synergy. And when you make up your hydration bags,
yes,
you talk about the synergy of one with the other and the other, and how some things don't work with this and some things do. So this is the same principle, right?
It is. But what I'm saying is people think of tea as harmless. And for the most part, it is. But do you really know whether it's right for you? I'm not sure. In other words, just don't go by the folklore. Let's look at the science.
Right. Well, you've often talked about, and how many times have you had this conversation with patients or potential patients? I'm taking this and that because the guy in the health food store told me that I should take that, and it doesn't really fit into what they're doing.
And I want to tell you that I looked about these herbal teas in many ways for many of my patients, and I've compiled 28 references to show, yes, their therapeutic value, but also their interactions. So guess what? It's out there, folks.
Dr. Molly always does her homework.
Try.
When we talk about something, if I'll say something to you about a particular problem I might have, and I can see your wheels turning.
Oh, yeah. Then I look some things up. Look,
I'm
always looking at the scientific. Listen, I'm a scientist, John.
Right.
I'm not a physician. I'm a scientist. And I tell my people, I'm all about what I put together thank God for the wonderful physicians I work with who allow me to use these on these patients. And they know they're getting something good.
So I guess the message here is, first of all, you're a patient in your office. At least speak to Barbara.
Sure.
About these kinds of things.
Right.
And then, take your advice and do what you have to do. For example, a couple weeks ago, Barbara made a list for me of things of new things.
Yes.
Right.
Yes.
And it was truly a list.
Right.
Okay. And I went down the line and ordered it, and it came in the mail, and it was,
That's right.
So,
and see, here's the thing, John, brands. You notice I don't sell anything orally.
Right.
I can't say about that for skincare because that's
You're
not
right.
true. But orally, I don't really have anything because we know there are tons of brands out there that are probably better priced that can do the trick, and we know the science behind them.
And also the company that you recommended, I mean, talk about terrific. I ordered it on Friday.
The science behind it.
And I ordered it on Friday, and it came on Monday.
Exactly.
So,
And so I want patients to be safe. My primary goal is to be safe, improve your quality of life, and make you happy.
So it's not only the hydration, it is also
You're going to get some advice. It's advice and counsel, but in a way that's very different than when you walk in and you get the standard of care brochure.
Right.
We're going to talk to you about your diet as well. The first gentleman caller we had, he changed his lifestyle. And that was important to work. So he did all that and got his numbers down. Imagine how quickly he would have done with EDTA.
Yeah, we're coming up on a break, and something that unfortunately affects many men, and Dr. Molly had a consult and wants to talk about that consult with regard to erectile dysfunction. So we will be talking about that after the break. And again, a reminder that our show is Health Watch, and we are here every Sunday, 8 till 9, here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the PhD doctor and the executive director and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Our number here in the studio, 855-839-1210, 855-839-1210. We tell you, don't wait till the last minute. Don't wait till the last minute. 855-839-1210 if you have a call or a question for Dr. Molly. With Dr. Molly Fantasia, I'm your host, John DeMasi. We return. More of today's Health Watch after these words. And we're back here on Health Watch. Operators standing by right now. They'll be there well after we leave you at 9 o'clock at 856-489-0505, 856-489-0505. That is the number for Innovative Medical Associates, Marlton, New Jersey. You have a question for the operators. You're a little bashful. You don't want to come on the radio. That's okay. Feel free to call them. And if you'd like to make an appointment, remember the initial consultation with Dr. Molly is complimentary. And we've talked to you that it's like 15 minutes. Yeah, right.
I can't help it, John. I'm mostly to blame for that because I find it's
that's
interesting.
All right. We'll let you slide on that one, all right?
Thank you.
856-489-0505. And the website, innovativemedicalassociates.com. innovativemedicalassociates.com. And if you miss any of today's show, or if you want to hear it again, it's our Health Watch replay every Sunday 4 until 5, right here on Talk Radio 1210 WPHT. We have a couple minutes left of the show, and if you want to jump in and ask Dr. Molly a question or you have a medical challenge, this is the perfect time to do it. 855-839-1210, 855-839-1210. I know, Dr. Molly, you had an interesting consult.
Yes.
And it's unfortunately a problem that many men have, and they're reluctant to talk about it. And it's erectile dysfunction.
Well, let me just say this. This was the most wonderful couple. It was a husband and wife, I believe, who came in, or maybe a husband and girl. I'm not really sure. But they were just wonderful people and very loving to each other. And it was an interesting consult because the young lady had a lot to say as well as the gentleman. And they seem to have a very robust life, let's put it that way. And what's happening is he's been going to a physician who specializes, I guess, his urologist gave him the name of a physician. He's been taking some ED drugs. Urologist gave him the name of a gentleman who's using the frequency, the radio frequency particular instrument that does blood vessels in the genitalia area, in the penile shaft. And yes, it does. Old blood vessels, broken blood vessels. We've all seen the commercial. That's true. If you utilize this locally, it should give you some relief, and you should indeed have somewhat of an erection. But, you know, it was interesting because I started the consult completely different. I asked the gentleman, how's your morning erections? How do you feel? What else is going on? Are you on any other medications? I said, didn't the other physician do this? Oh, no. Well, I'm interested in this because it tells me about systemically what's going on as well as hormonally what's going on. And when I looked at this, I said, you know, this is an interesting consult. And I actually had one of my other docs sitting in there with me. It was an interesting thing. And I said, you know, I turned to the doc. I said, what do you think about his cardiac output? She goes, I think you might be right that it may be affected by plaquing. Because if, gentlemen, you have some plaquing in your shaft area, think about this. Do you think you might have plaquing systemically?
I would say yes.
Absolutely. Absolutely. And so we looked at this. I said, yes, I think that's a wonderful process. It's a wonderful instrument. I give it a wholeheartedly recommend it. But I'm thinking that when you're doing this, you ought to think about doing some chelation as well. Because if we can improve your blood flow, right, that's what he's doing with working with the shaft. But guess what? Is it enough to sustain it? You may get an erection, but can you sustain it? And that was an interesting comment because that's what the woman was saying to me. It's good, but he can't sustain it for her. And so, listen, guys, we need to look at that because you want to make your woman happy because a happy wife is what? A happy life. A
happy life, exactly.
That's right.
Yeah.
And so I'm saying that there's more to this in terms of blood flow than just utilizing the radio frequency. Although it works in many, many, many cases, I believe in lots of severe cases, there is systemic plaquing going on, and we need to address that first.
You know, I'm surprised you haven't had more consults on this particular issue.
Well,
because,
we have had a lot.
Yeah,
but
okay.
They don't really think about it in terms of systemic plaquing, and that to me is interesting. I think men just think of it in terms of the localized, and localization is one thing. But, you know, when you start thinking about this and you start thinking about some other issues you're having, also, I'm looking at things from the hormonal level, the neurohormonal regulation. I would say I found it interesting because his estrogen, he was another gentleman whose estrogen level was a little bit elevated. And I probably would have looked at this, discussed it with Dr. Mark, and looked at putting him on other supplements as well as the ED drugs.
We should also talk about caution with these kinds of things.
Oh, my God, yes.
You remember that time I showed you those pills?
Oh, my God, yes. Yes, I do. John, that was unbelievable. I took those pills with me to a conference because they were great.
Yeah. I said, you said to me, well, look, if you take those, you won't have to worry about any kind of erectile dysfunction because you're not going to have any function at all.
That's right. You may be dead from the cardiac implications. But I thought it was so interesting that one of my patients who was a physician. He said, oh yeah, no problem. If you can have an erection, if you have an erection for longer than 4 hours, go call your doctor. He said, call all your friends because it may be the last time you see them.
That's right.
And it was, what? I just thought, oh my God, but there is some truth to all of this. And yes, we're all about a healthy lifestyle. That's quality of life, John.
Right.
That's what
That's
I'm
right.
all about. That is a quality of life issue. So in my mind, that was a perfect issue to bring to our clinic because, yes, we want to improve your quality of life and your partner's quality of life.
And we wanted to impart, and that's why I told that story, that there's all kinds of things out there.
Yeah, the health food store. Yeah,
I mean, you see stuff, and then on the internet.
Oh, a ton
wow.
of stuff.
I mean, there's like.
You got to be careful.
Exactly.
You got to be careful because, again, just talking about the herbal teas. How about all the teas they have for this? They have a ton of teas. Half of those have all kinds of stuff imported from China. We don't even know what the heck.
Exactly.
So you got to really be careful about these kinds of things, guys.
So if you do have a patient, and this was a consult, but if someone comes into you and has this problem.
I've treated other people like this.
What is your normal course?
Well, what we're going to do is we're going to run his blood work. Okay, we're going to look at cardiac function. We're going to look at plaquing, and then we're going to proceed accordingly because the chances are he needs improved blood flow head to toe, 12% in order to sustain the erection.
And then beyond that, what would be the course of action?
You want to then do a follow-up maybe every 3 months, 2 to 3 months, come in for an additional treatment on the hydration. And we want to talk about supplementing with maybe bioidentical hormones and also some natural products to help reduce the estrogen conversions.
I want you to talk about all of the products that we see on TV advertised for this problem.
There's a lot of them. You just have to be careful.
Okay, is there? I mean,
well, there are natural substances again that can inhibit estrogen. So yeah, you want to take them, but you also know I'm a big believer in bioidentical hormones for men. I don't believe in the steroidal stuff that people go in and shoot up. I don't particularly like that. I think it puts guys in harm's way. But I also know that there are a lot of bioidentical things that can be done for men's health. And we're big proponents of that. Both Dr. Mark and I are both proponents of it.
Well, the reason I asked you that is I know guys that say to me, oh, I take that little blue pill. It's fabulous. I love
Great.
it.
Good. But, I don't know. Here's the thing.
I wouldn't do it,
No, you shouldn't do it based on some other stuff. But here's the deal. Does the little blue pill work? Sure it does. Question is it sustaining what you want? Are you having a sustained love life? Are you doing that? No, chances are not. Until you get back into homeostasis, which is balance in life, right? From birth to death, we should be in homeostasis, which means in the best possible place for our immune system and to also have all of our neuroendocrine systems working properly.
So it's kind of like, and you've often talked about pharmaceuticals, perhaps maybe masking the problem and maybe not dealing with the problem.
Right,
so you're talking about dealing with the problem.
Exactly. Let's look at chances are in a normal healthy guy, 58, 60, there is no reason, even 70. Listen, I had one guy who was 80 some years old and he had a very robust love life. Okay. And you know what? I think if from birth to death, we should have these kinds of things. That's what quality of life is all about.
And that's what
That's it. That's what we do.
You've been talking about that since you began.
Exactly. And that's what we want to do in every area of your life.
You're now 24 years, and I'm still waiting for the second book. Come on,
I'm working on it. Actually, right now I'm working on it, and it's interesting because it should be out, I would say, in the next 60 days.
Okay, because it's Christmas. It's a good Christmas gift.
That's all right. I think a better Christmas gift is come in for the free consult see if we can help you out.
There you go. And with that, we're putting the wraps on another edition of Health Watch, and you heard Dr. Molly say the initial consultation. Operator standing by right now. They'll be there well after we leave you at 9 o'clock. 856-489-0505. 856-489-0505. And, of course, you can check us out on the web, innovativemedicalassociates.com. innovativemedicalassociates.com. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, we have Barbara, we have delightful Dee, fabulous Fran, our nurses, Jess and Crystal, and our medical assistant, Kathy. And also, don't forget our Health Watch replay. If you missed any of it this morning, replayed this afternoon, 4 until 5 here on Talk Radio 1210 WPHT. Have yourself a great week, a safe one, a happy one, and a healthy one. Don't forget to vote. And we'll talk to you next Sunday. Health Watch, 8 till 9 a.m. here on Talk Radio 1210 WPHT. Take care.